Today, I am also very happy to present to you a new study on krill oil in heart health. ये स्टडी जो है बहुत ही इंपॉर्टेंट और बहुत ही इंपॉर्टेंट स्टडी है जो कि इसी साल पब्लिश हुई है जनवरी 2022 में. This study got published, in fact, in one of the most prestigious journals called Journal of American Medical Association, commonly called as JAMA. This study is very important, very path-breaking, not only because of the results जो कि इसके आए हैं, but also because of the size of the study that it was. So there were 520 patients, 164 different centers across America and Canada, and what is also more important is that it is a large study of which costed around $40 million. 26-week study, long study, which clearly proves that there is a significant reduction of triglycerides when you use krill oil. इस स्टडी के बारे में और बताने के लिए I am happy to introduce our Director of R&D, Human Health and Nutrition, Dr. Katina.
Hi, this is Katina Handeland, greeting you from the Aker BioMarine's headquarters in Oslo, Norway. I am the Research and Development Director for Human Nutrition here in Aker BioMarine. And I have a background where I have a master's degree and a PhD in human nutrition. I have spent several years researching into the different health effects that humans may have from eating or consuming omega-3 fatty acids. And I have been working with the research and development of different omega-3 derived products for human health for the past 5 years. And now I'm very excited to share with you some recent results that we received from a study that was conducted in heart health patients. This study investigated the impact of supplementing the diet with either krill oil or a control or a placebo on the levels of triglycerides in the blood. But what are triglycerides? Triglycerides are mainly just fats that circulate in our blood, and too high levels of these fats have been found to increase a person's risk of developing a cardiovascular disease event quite dramatically. There are several mechanisms behind this effect, but the main mechanism is that the triglycerides can lead to fatty deposits and plaque buildup inside the blood vessel walls, leading to blockages and perhaps also a blood clot or a heart attack. So if a person has higher than what's recommended levels of triglycerides in the blood, then this person is at increased risk of developing a cardiovascular disease. And in the recent study that I will talk about, they recruited patients which had severely high levels of these triglycerides in their blood at the beginning of the study. And they wanted to investigate the effects of supplementing with either krill oil or cornstarch, which was the control, daily for a total duration of 26 weeks. The study had approximately 500 participants and was thus one of the largest studies in this patient group performed to date with omega-3. And the results were quite interesting. They showed that krill oil gave a significant placebo-adjusted reduction of triglycerides of 10.9% after 12 weeks, which was the primary endpoint of this study. And this effect of krill oil was further increased to a 12.7% reduction after 26 weeks of supplementation. If only looking at the isolated effects of krill oil and not taking the placebo group into account, then krill oil gave a 26% reduction in triglyceride levels after 12 weeks and a 33.5% reduction after 26 weeks. This was one of the longest lasting and also one of the largest omega-3 clinical trials performed to date in this patient group. And the results are very interesting and can also be regarded as clinically relevant for this patient group when interpreting the results and the effects that they may have on reducing a person's risk of developing a cardiovascular disease event. Thank you for your time.
So, as Dr. Katina explained, this very important study the final outcome of this says that krill oil reduces triglycerides by 33%, and that too without increasing the bad cholesterol LDL, and raises the level of omega-3 index just in 30 days. Now looking at those people who were taking medication for high triglycerides levels at the time of study, मतलब इस study का जो subset है, out of 520 people who were in the study, about 254 people, they were on the medication, on other medications like statins basically. So when you see the effect of krill oil in this people who were taking other medication, the effect is even more stronger. And it is stronger by 19.5% when you see a 12-week period and 22.3% when you see a about 26-week period basically. What does this mean? This means that those taking medication could benefit even more with krill oil. Okay everybody, towards the end of this session, now मैं आपको ये बताने की कोशिश करता हूँ कि किसको, क्यों और कितना krill oil लेना चाहिए जिससे कि हार्ट हेल्थ में बेनिफिट हो. So सबसे पहले किसको? People who have high triglycerides, people who have heart disease, people who have heart disease and are taking other medications, and also people जो कि looking for maintaining heart health, उन सबको Vestige krill oil लेना चाहिए. क्या फायदा होगा Vestige krill oil का? Vestige krill oil हेल्प करता है हेल्दी कोलेस्ट्रॉल को रेज करने के लिए, which is the HDL cholesterol. It helps to prevent blood clots that can cause stroke, heart attacks. Vestige krill oil helps in reducing the risk of overall coronary artery disease basically. कितना लेना चाहिए? Dose of Vestige prime krill oil for cardiovascular conditions is about 1 gram to 1.5 grams per day, जिसका मतलब 2 से 3 capsules per day लेनी चाहिए. Ideally, it should be taken for 4 to 6 weeks minimum, जिससे कि Vestige prime krill oil के benefits बहुत clearly visible होंगे. Thank you. That is all that I have for today.